we know that some of the wound, they never heals. Wound on the foot is a major problem. Reasons are many why they refuse to heal. Myself, Dr. Devender Singh, I am a vascular surgeon at Yashoda Hospitals, Somajiguda. The reasons are not one. There are many reasons for that. One of the major reasons is diabetes. In diabetic population, we will have less blood supply, we will have neuropathy, we will have infection. So when we have this combination of all three conditions, the wound refuses to heal. Out of all three, the most important one is the blood supply. If the blood supply is not good, the wound will never heal. In spite of the fact you can give n number of tons of antibiotic, it is not going to heal unless until we correct the blood supply. So that's one thing which is very, very important. Venous insufficiency. If the blood is not pumping up, then the reason for non-healing ulcers, the reason for ulcers not to heal, because the blood is getting stuck there, it is not pumping up. So that makes a condition known as chronic venous insufficiency or a varicose vein. That is the second condition when the wound refuses to heal. Third one is when you have a condition where there will be a lot of inflammation in the body, what we call is vasculitis. One has to be very, very careful in making this diagnosis, because this is the diagnosis which can be treated very well with medications only. So the ulcers which refuse to heal, the ulcer which are very, very painful, one should suspect there is an underlying vasculitis. Vasculitis is nothing again, it's the inflammation of the muscles, inflammation of the blood vessels. So we have to treat and make a diagnosis correctly. So these are the few conditions. Also in patients, when you have joint restrictions like arthritis, again, if the joint is restricted and the blood is not pumping up, then again, that is one reason why the ulcer refuses to heal. So one has to be very, very careful in making a diagnosis. Clinically and with the history only, we can make a diagnosis rather than going for very high-fi investigations. So we have to keep in mind whether the vascularity is good or not, whether the blood is pumping correct or not, or whether there is any neurological issues. Like sometimes we have these neuropathies when we have like conditions, leprosy, or when we have other conditions where again, because of neuropathy, it will never heal. So if we make a diagnosis in time and we can accordingly protect our feet, we will make the ulcer heal. So be very much careful about these diagnoses and try to take a proper history and clinical examination so that we can rule out the different causes and we can attack the ulcer and make the ulcer heal. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.